Good morning, everybody. Zach Marzo here from Melman Podcast.
David Melman.
David is here with us. I'm going to start this morning off a little bit differently. This is our first episode in this podcast studio, if you will, which I'm super excited about. Kind of the next chapter beats the conference room that we were shooting in, before. But I have Dr. Kiana Fluellen here, body goals, physical therapy and wellness with Andre Fluellen as well. Super pumped. They're in Roswell. It's all about supporting the local community. I'm talking 1,000 miles a minute, but I'm ready to go. It's Monday. I have my coffee. I want to start it off and simply just pass it along to Dr. Q, let her introduce herself, what Body Goals is doing, and we're just going to kick it off from there. Appreciate you guys coming on, most definitely.
Yes, thank you for having me. My name is Dr. Q, Dr. Kiana Fluellen, and I'm a physical therapist and owner of Body Goals Physical Therapy and Wellness. We're located here in Roswell, Georgia. We've been open for just 2 years now, but I've been a physical therapist for 9 years, and I have a doctorate in physical therapy. I went to the University of South Florida for my doctorate, but met my husband, Andre, at Florida State University, where I ran track and he played football.
I was wondering how you guys met. Makes sense.
Cool. So we met at Florida State, Go Nose, and I've been in the physical therapy field, like I said, for 9 years. I have a great background in orthopedic sports rehabilitation, but I also see geriatrics, older patients, because I'm from Florida, so I worked in Sun City, Center, Florida, where you have to be 55 years old
gray hair
to live. But those folks down in Florida are very active, so I saw a lot of golfers, bowling team, all that. So I really get the active adults athletic here. So I see everyone from a 15-year-old high school athlete to a 90-year-old retiree.
That's huge because I wasn't even thinking of obviously mentioning this, but I drive down, live in Woodstock, obviously Melman Law Group's here in Georgia. I pass like active adult and senior living, like brand new facilities. Even I think there was one in Roswell, which is huge. I don't know how people get in there, but because I know you guys do kind of the in-home care. So if you can, somehow plug into those into that market, so to speak, where you can go in and do that. I feel like, everybody wants to move to Georgia. Everybody's leaving, New York and the North to come down here, enjoy the sun, play golf, and feel good. So that's really cool. I feel like that's an awesome avenue to, potentially pursue or, that you can tap into.
Absolutely. I mean, any way you can tap into a market and then figure out how to get in and scale it, it's exciting. So you had the experience working for somebody, then you decided to open up your own business.
So I've worked in several different practices. Like I said, in Sun City, Center, Florida, I was at an acute rehab facility. So after people had hip replacement, knee replacements, or a stroke, and I got them back to going back home. A lot of them were snowbirders, so a lot of the families really depended on me to get their mom or dad together so they could get back independent, so they don't have to, travel back and forth from the north to the south. Sure. When I moved up here to Georgia, I got into the orthopedic sport, so I worked with another chiropractor and a physiatrist where we were in a gym-based setting where we did a lot of sports-specific training, and my husband, who was in the NFL, I helped him out on and off season, and we had 2 kids back to back, and finally I was ready to move on to do my own thing once he retired from the NFL, and I felt like I was seeing too many people at a time and couldn't give my all when I was working for others and a lot of the politics, and I was ready to step out on my own to give my brand, start my own brand, so I was ready.
And how'd you guys do that together? Like, how do you support her during this, and with your prior skills with, being in the NFL? Did she help you a lot during your injuries or anything like? Explain that kind of to us.
Yeah. So, so a little bit about me. I played 8 years in the NFL. Most of my career with the Detroit Lions. Like I said, we met at Florida State. And so even going through the NFL, so I like, kind of telling this story. So I guess my 4th year in the NFL, just check this out. All right. So I'm, a strapping 26, 27-year-old man, right? Alpha male
killing
at the point in time,
right? Sure.
And then one day I wake up and my left knee is just swollen, just swollen. Like I couldn't believe it. And I had no idea what happened. And so then, maybe 2 weeks later, my right knee swells up. Now check seriously. This was during the offseason. I was just about to sign a new contract with the Cincinnati Bengals and the Rams. They had offered me a contract, multi-year, multi-million-dollar contract.
Jeez.
Seriously. Like, this is,
you woke up and like, boom.
and this was like 2 weeks before I had to take a physical there.
Right, right.
So I'm freaking out. And so, they bring me for a physical, and they look at me. They're like, dude, what happened to your knees? I'm like, what are you talking about? Like, dude, you have the knees of a 75-year-old man. You need to retire. Like, that's what the doctors told me.
Jeez,
Yeah.
right.
So that was my 4th year. So no contract, no nothing. Thank goodness that the Lions, they signed me back without a physical.
Sure, without a physical.
Without a physical, because they knew me, right? Yeah.
Wow.
So they knew me. So so man, yeah. So go through that year, and the Lions cut me like in the middle of the season.
Sure.
And I was going to retire. Like, I just couldn't do it. Like, I could barely walk, man. Like, I was a dude. I was squatting like 600 pounds, bro. I couldn't even squat 185. Like, I couldn't do anything.
Bad.
Yeah, it was that bad. So this girl right here, right?
All right. Yeah.
She looks at me. She was like, man, I'll tell you, I don't think it's your knees. I think it's your hips. She's like, you're just out of alignment. I'm like, whatever. You don't know what you're talking about. You're still in school.
Right,
You're
right.
like,
Sure.
You're still in grad school. What are you talking about?
Yeah.
Man, this girl developed some stretches for me. I do these stretches. I still do them to this day. I end up playing 4 more years, 0 pain. Till this day, I have 0 pain.
Amazing.
Like 0.
It was the hips.
And it was just stretch.
Tight hips.
Tight
Really?
hips, yeah.
Wow.
So I just, she just taught me this progression of stretches, and I do them every day.
Every day.
Still, right
Sure,
now. If I don't do them, my
Stress
knees
more
hurt.
than I do.
Really? And you feel good every day.
Every day. Like, I can do stuff that I can't even believe I can do some of this stuff now.
Right,
that I'm still
right.
doing. I'm supposed to be like, I'm supposed to be a former player. I'm supposed to be messed up every day, and I'm not.
You feel good every day.
Every day.
Awesome.
Yeah.
And that, what kind of partner can you have when, I can't imagine the toll your body takes. And then you have a partner right next to you that understands the body, does her thing, and look at you now feeling great.
Absolutely.
Oh, man, things work out crazy, I mean, I guess overcoming adversity and things like that, like for me, it'll be tough. Your mindset's to go crush it. You got something lined up there, and then boom, next thing you know, your knees are hurting, and then they're looking at you like there's no contract. Thank goodness, like you said, the Lions took it back, no physical. It's crazy things, You see this every day probably in your business with rehab and athletes and in post-surgical care. How often do you see people fully recover post-surgical care?
I'll say about 80 to 90%.
Right.
The other 20 to 10% is really the person limiting themselves or maybe some pre-existing issue, maybe diabetes or dementia, something else is inhibiting their rehab
Right.
or their recovery. So for the most part, if they follow the certain protocols, and I always tell them to do your homework, I can tell when they're not, and then that will help with the progress. So I work well with local surgeons, but I'm also direct access. So I have a lot of patients who come straight to me, Dr. Q, I sprained my ankle. You don't have to go to a doctor in the state of Georgia. Come straight to me for direct access. So I see both.
You said 10% as in like mentality, like they're just mentally not there to overcome?
Or it's just a lot of mental. So Dre is a certified mental coach, and he's also a motivational speaker and things like that.
Absolutely.
So I do a lot of mental goal training, goal setting. That's what physical therapy, we set goals. Where do you want to be in 3 months? Where were you before surgery? Where are you after? And a lot of people are not having surgery. A lot of surgeons send patients to me to prevent surgery. A lot of people need to know that. Surgery is not always the first step. It's always the holistic step because insurances and different things like that. So I always tell people 1 day at a time. And a lot of people are able to get to places where they haven't been in a year just by starting some sort of therapy, stretching, and also do virtual training and stuff like that. So
that's a great point you bring up, because clients call us and they recommended surgery, but they don't want, it's the last thing they want to do.
Yes.
And if they can get into your hands, or it's just better for them, especially if they can avoid the surgery.
Yes.
We see it every day in our world. I talked to a client last week on that. They don't want to do it. They're scared. They don't have maybe the 6 weeks of money to recover during it. Because you have, after surgery, you don't work. A lot of people aren't working, depending if it's knee surgery or what the recovery time is. But if you can avoid it, that's amazing. That's where you can come in and give them some peace of mind, because, when people think just surgery and you're done, there's a lot of, like you said, post-rehab, months and months of getting better. And if their job is demanding on their feet all day, how are they going to support their family?
Right.
So you can help them with that too. Not only are you helping them physically, but you're helping their family.
Yes, I definitely do. I always tell a patient, come in, try it. And if it's making it worse, then we'll stop. I always refer back, but we always try rehab for a few weeks before and or after, just to see if you could get some gains without going under the knife. That's the whole point of physical therapy.
Got it. And body goals now.
Yes.
What, 2 years in?
Yes.
What's your plan? Let's say in 5 years or 3 years later. What's the goal? What's the vision?
My vision is for me to step back a little bit.
Got it.
I definitely see myself hiring very soon because we are growing, and I cannot see all these patients at once.
Sure.
We also, since I have in-home visits, but I also have my brick and mortar, I would like to stay in my brick and mortar a little more. So I see myself building the in-home visits, not just because of the homebound people, but COVID's around, and a lot of people do not want to come out of the house.
Very true.
So I would like to build that. Also, I see our virtual training program. What we do modified online programs for people who have pre-existing injuries, who are scared to go to the gym-based fitness training or just buy a regular fitness training online. I do a lot of modifications. So if someone have a knee issue or a shoulder issue, I have different programs online, and I've seen a lot of progress with patients with weight loss and also mobility.
Okay.
And I also see me and my husband doing more speaking engagements together. Pre-COVID, I was going to a lot of senior centers doing fall prevention training. So that's how I built my relationships with a lot of seniors in the area.
Right.
And also I was going to a lot of sports-specific training and doing mobility clinics. So now we have to think of different ways, since the gyms are open back up, but I don't see the senior centers opening back up anytime soon. So we have to think of more virtual things like this podcast and different things like that. So we have to think of more virtual.
And that's what we did. You have to adapt. You have to adapt to the time. You know, we're thinking, 3 months ago, like, what are we going to do to change it up? And how can we help the local business community, as well as maybe get our name out there too,
Correct.
But this show is about you guys, and you have to adapt to change.
Yes.
And like the good leaders will adapt. I think the bad ones will just fall off. People are falling off, maybe not because they're bad leaders, but just it's mindset. You don't have the mindset. Everybody can do great when you're on top, right? It's how do you do when you're at the bottom or things are hurting? And that's what fuels me. I wake up every day and I'm hungry. I'm hungry, whether it's, it was a bad day before or whatever it is, or like one experience will not stop me from trying to go over. Like COVID, like we're back to normal. I get to say, like it's over. Like the business of being down is over, not COVID. But like we're hungry. Now we're going to go above it. A little setback teaches you to be more humble, appreciate what you have, and attack.
Yeah, that's cool.
To.
How do you, like, just David reminded me, or I'm thinking of, like, I guess, when you get knocked down, you get back up. I'm sure that was obviously, a big part of being a pro athlete, of winning, losing, and how to kind of, stay hungry even though the season might not look great. There's a lot of injuries or, you're just not feeling, well. But I guess from the mental kind of coaching side, how does that, it's tough to do, right? Obviously to, get back up when you're being knocked down, but I'm sure that was something, you dealt with all the time.
All right, hold on, dude. I play for the Detroit Lions.
Bills fans. Bills.
I play for the Bills too.
Yeah.
But I play for the Lions, right?
I didn't want to say that, because I was going to say, but I can't talk because even though the Bills look like they're going to, go one direction this year, fingers crossed, I still don't hold my breath. But anyway,
so
exactly.
My first year, inaugural year in the NFL, man, we went 0-16.
That was
that year?
That was that
man.
year.
All right.
Yeah. So I go down in history of I say it like this. Like I had the perfect season, the perfect losing season. You cannot lose better than we did that year.
Sure.
I had a perfect season, right? First perfect season in the NFL. Right. That's what I look at. But anyway, so when I look at that, like every week, I guess since I was young, I didn't realize, it took me a long time to realize how hard it is to win in the NFL. And in business, it's really the same way. Like everybody's attacking the same dollar. Right? Like everybody wants the same dollar. And so what do? You have to do something a little bit different. And sometimes it's not even about working harder. Right? Like a lot of times we can kind of get lost in the working harder. We think, because I'm working harder, because I'm doing more, because I'm just moving, man. But a lot of times, man, we're just in a rocking chair. Right? Just rocking back and forth. Right. But not going anywhere.
Right. Good
so
point.
it's about just how do I work efficiently and work smarter, and then be able to put that hard work and that grind into that. Because a lot of people are getting burned out by just working. I mean, they're working hard too. But man, like there's a song, J. Cole said it like this. He said, man, the good news is, man, you've gone a long way. But the bad news is you've gone the wrong way.
Right.
Right.
Sure.
Like seriously.
Yeah,
And that's
yeah.
what a lot of people are doing right now. So
Yeah.
so we try, even in physical therapy, she tries to focus people's direction into going the right way. Like, we had a client a couple weeks ago that was had a back injury, was doing all kind of back exercises. She's like, don't do that, right?
Sure.
And he's like, but I'm strengthening my back. Yeah, you're strengthening it the wrong way. Those are the motions that are hurting you.
Right.
Like, don't do those
Adjust,
things. You know,
yeah.
right? So these, it's similar. Everything is, I feel like life is always parallel. It's
For
similar.
sure. What's more difficult, do you think? Business or NFL? If you don't mind me
Oh,
asking.
dude.
Is that a fair question?
Dude, business is
I was
way,
thinking-
way harder.
When-
See,
yeah.
because here's
Tell me.
why. Like, so one of the things in the NFL, like, especially growing up or even in college, like, I was always told what to do.
Right.
Like, I was told when to be somewhere. I was told what to work out. I had my workout card. I had my playbook. I had all that.
Right.
In business, there's none of that.
They throw you out there
They
and do
throw
it.
you out there, right?
Right.
And I'll tell you, one of the best things in business for me was having a cold call people. Cold calling, man, I respect.
You like that?
No.
I was going to say,
No.
I know.
Stop that.
I know. It's tough.
Yeah,
I
right.
know.
But
I
like
know.
it helped me because it makes you do something that you just don't want to do, that people really don't have a skill. They usually don't have a skill for, don't even want to do it. Now I have a skill of doing it. Now I can pick up the phone, call anybody. I don't care.
Right.
Right.
Yeah.
But that was a good thing. I needed that because that's business. That's part of it.
Sure.
Right. So,
Sure.
but yeah, business is way harder than football.
I think so. I mean, 2 years. Like, we're only 4.5 years in our business. Like,
wow.
we're new.
Yeah.
Like, we're sitting here, but our mentality is take it to another level and crush it. I was on Instagram and I saw you at your office like on a Sunday.
Yes.
Yeah, right. Or Saturday night. You guys
Yeah.
were gonna go like date night or something, right? I saw it.
That was
You
this
guys
past Sunday.
you
Yeah.
guys-
We were there.
You
Yeah.
guys are still there, so you're putting the time in. You bring up a good point about getting burned out because you don't want to get burned out. You have two little girls, right?
Yes.
Have two little boys, so you want to make sure you can spend some time with them too. But if we're not going to get it, someone else is going to get what's ours. That's my
Right,
mindset,
I
right?
agree.
So, we're competing for the same dollar, exactly like you said. So you want to work really, really hard to get it. You want to work smart to hit it. You have to adjust. We try to adjust in our business model with the podcast, a couple other things we're working on. But you have to adjust and think outside the box. Like in our business, a lot of people do billboards, right? Why am I going to keep doing billboards when I can reverse it and go around and do something else?
Yeah.
So you got to be creative too. You have to be creative in your business and your approach. In COVID, senior citizen centers, you probably can't even go into now, right?
Yeah, right now I can.
You can.
I'm going
Okay,
to
tell me.
assisted living. I can go in, their family can't.
family-
So
Wow,
the
sure.
family, I'm a medical provider, so the
course.
family trusts in me. Hey, can you take a picture of my mom? Can you text?
Yeah.
Can you
Jeez.
send a video? And it makes me feel so good
Mm-hmm.
because those people do not have a lot of people visiting. They're scared to go out into the hallways. So I'm one of the only interactions they have right now. So that gives me so much joy. And that what's keep me going every day is that I'm the only one visiting, helping, but also giving them some sort of interaction and giving their family some comfort.
Sure. And I'm going to give you an example of how it gave us comfort.
Yes.
About a month ago, my wife's grandmother was in an accident. She was walking and some drunk driver hit her, right?
Goodness.
Bad. And she was in the hospital. And we couldn't visit her. They wouldn't let us visit her. And the nurse there, she got the FaceTime out. And
Yes.
every day, a couple times a day, she would do the FaceTime.
That's-
And it was the most comforting thing for my mother-in-law, my wife, and myself. Just,
Absolutely.
you can't see them. Like, how nice is it of you to be able to do that,
Yes.
on top of helping them physically?
I just
that's
put
really nice
myself
of
in their
you.
shoes.
Yeah,
so
imagine,
I
could you
couldn't imagine.
So that's really nice to hear.
It reminds me of like that's like the service side of things. You obviously have like warm personality. You feel like, if Dr. Q was coming to my house, like, cool, my parents are in good hands. Because the last thing that, we want, and we deal with medical providers all the time, is just the bedside manner. It sucks. It all comes back to service. You could be the best physical therapist in Georgia, but if nobody likes to be around you, they're not going to listen. They're not, you're not going to do that. So it's awesome that, you're doing those little things and other families are comfortable enough to, put their parents and whatnot in your hands, and you're providing really kind of like a lifeline there because they're relying on you to help them not fall. The majority of the, we do a little bit of slip and fall stuff with Melman Law Group, and most of the time it's in a nursing home or in an apartment where they're living alone and they trip on something, fall prevention you were talking about. So just reminded me of the service side.
And you're going to have to bring somebody in. You said you guys are working hard.
Yes.
So the person you bring in is going to have
Gotta
to
be the
have your
same.
mentality too.
Have
but they
to.
can't have all of your mentality because then they're going to open up their own business.
Right.
So it's complicated, right?
It's so
And,
complicated.
you know,
That what makes me the nervous about growth.
Sure.
Protecting my brand.
Sure.
And protecting my patients because they are my family. The Medicare population, they're my patients for life.
Right.
So
Right.
I see them all year, or
Right.
they might take a few months off. They come back
Sure.
because they feel comfortable. So I want to protect them, not
you
only
want
my
to protect them, your
Yes.
brand, and even if because people are going to branch their wings and try to go their own route.
I know.
They can give you a good couple years
Yes.
of hard work, and you see that you'll even you'll help them on their
I'm
voyage
okay with
out
that.
because they're
Yeah,
good
of course.
people.
Totally.
But you got to find the right people to get in
Yes.
there, just to trust because we have a team we work with, and I love everybody in there.
Yeah.
But I'm very careful on who I bring in there. Right. So you
Absolutely.
got to that's a big stepping stone to trust to give somebody that
Yes.
my team can make some phone calls and emails, very important work. Your team now is going to be hands-on in there, so you got to really trust the person that you bring in, and I'm sure you'll find the right person eventually.
Yes.
It takes some time,
Yeah,
but
just gotta vet them.
you have
Yes.
to vet them because you got to, my biggest thing is understand, I understand that Marina and I love our business to death, and I don't think anybody's gonna love it more than us. You got to let that
Right.
go and understand that. And if you can give up 10% of the mentality of they're going to love it, they're going to care for it, but they're never going to be you,
Yeah.
it'll give you some peace of mind because you're never going to expect that person to be you. And that was one of my flaws in the beginning because I expect everybody to be me. But then as I grow and I learn, they're never going to be you because they're not you.
Right.
So if you can give that range of not being you, it might make your mindset easier.
It's
That's great
interesting.
advice.
It's interesting when you say that because I'm not, an owner in, Melman Law Group or really have never had my own business itself. I've always worked for somebody, but I guess it's just finding the person that, I guess acts with not integrity. Integrity is the wrong word, but I care about doing well for myself so that when I go to sleep at night, I know, I did a good job. I don't want anybody else talking they kind of were lazy, they half-assed it, whatever it is. So I may not, care about a brand as much as the person that owns it, but I care so much about doing well myself that, that's kind of the person you want to find as well. So it's tough, but those people exist because I want to do super well for myself. It only translates into doing super well for Melman Law Group, but
they definitely exist. There's
I
one
need,
sitting
do you
right
do
here.
physical therapy?
You know what I mean?
Yeah.
Go ahead. Give me your background.
Well, I did. My background is weird because I went to school for accounting and I graduated and I took the CPA exam and I thought I was going to do that for the rest of my life. And I lasted about 4 months in public accounting because it was just the worst. So I was bouncing around restaurants. My brother's he owns some Johnny's Pizza franchises in Charlotte. So I did that, managing 16-year-old kids, trying to get them to wear a hat in the kitchen. I wanted to, rip my head off and then rip their head off. It was the most frustrating. Trying to, we talk about managing professionals, managing 15, 16 restaurant owners. I give it to them just because that's tough. They don't have to work. Mom and dad are telling them that they need a job and you're babysitting. But anyway, then I did some personal training at a Fitness Together, which is another franchise in Charlotte. And I didn't make any money, close to minimum wage, but I still, represented the brand as much as I possibly could. Sometimes I don't know why. I feel like maybe it's a little intrinsic factor, motivating.
You're
but
a good person.
I guess, I don't know. It's
raised,
weird.
too.
We always try to think that, who can we find and how you peel back the layers to see who they really are. But they probably do that in professional sports too. They have interviews. Do people interview players and whatnot, or how deep does that go?
Dre does broadcasting, so.
Okay, yeah.
Yeah. So I mean, absolutely, you got to think about the broadcasting, or even going back to when I was at the combine, right? I mean, think about it like this. I remember when I was at the combine, and I think I was being interviewed by the Patriots,
Right.
Okay, and so
Dang.
the Patriots, it's Bill Belichick and a bunch of other Patriots staff in there. And they said, "Hey, man, we really like your background." And I was like, "Well, what do you mean?" Like, "No, you had never gotten any trouble." I was like, "Yeah, of course. I was raised well." He's like, "No, but beyond that, man, we talked to your 3rd and 4th grade teachers, and they talked about how good of a kid
my
you
God,
were."
dude.
I said, "What?"
That deep.
What? I didn't know that.
Yeah, I mean, they went that deep. They went
Wow.
that because you got to think, man. They're not just paying me. I'm representing their brand.
I know.
Right?
That's so true.
Yeah, so just like you were saying, even though I'm not an owner of the Patriots, if I got signed by them, I still represent
That's a
their
great
brand,
point.
their
Absolutely.
brand. And so even so now, working with my wife, even though we work together, but this is Body Goals. This is her baby, right? So I have to represent her brand in the correct way, in an accurate way. Even though I'm the janitor, handyman, tech, marketing director,
mailman,
everything,
whatever it takes, right?
Chauffeur, right? Whatever it takes. But all those things, it adds up because I have to make sure that I'm supporting her brand to the best quality. So it gets frustrating at times because we are married too, right? So she is the boss too, right?
I know, trust me.
Then so sometimes she'll be like, hey, you did that wrong. I'm like, oh God, I know I did, but I don't really want to hear that from you. But yes, I know. But but it's still, but it's just the truth though, because sometimes I had to realize she's not really getting on me. She's just protecting her brand. That's what she has to do.
And that's her brand. That's her baby, like you said. 2 years in, it's a little toddler. Right. Let it blossom and do its thing, because
but it's sensitive times.
Like it could be endless on what happens. Fast forward, like the growth from 0 to 2 years is more. It could be a grind, a lot of hard work. But then you start bringing people in and figuring things out. Year 2 to 4 can be explosion and growth. Now, from building a foundation and a base to now the same year could be a whole different game changer.
Yes,
got to have the right people in there. Nothing like the right hand or left hand being a significant other. And that's why my wife and I, we get along. We bring work home a lot too, though.
Same.
We talk about it way too much. I'm guilty of that in front of our kids way too much. We got to get better at that. So how do you deal with that?
He just brought that up to me some days because Andre, he helps me with Body Goals, but he has his own investing company.
Sure.
He does his speaking. He does other things. And I sometimes put too much on his plate. So that's why growth comes. I'm like, okay, maybe we need a virtual assistant to help, me not talk about it as much with you.
Sure.
And so we could spend more time at home with kids.
Because you guys are married. So, I mean, kids, vacations, family life, family dinners and things like that. I'm guilty of it.
Yeah.
And it's a learning process.
Yeah, it is.
It's a whole learning. Like, no one's perfect, I think, in that.
Right.
Talked to a guy last week with 13 clinics, and the biggest thing he said was being present. So at the moment. So he just says, be present. If you're there and you have those couple of hours, value those couple of hours. Like, put the phone away, and I'm guilty of that too. So get the phone away and be fully present, because you know what? 2 hours of being fully engaged is better than 6 hours of being partially engaged.
Yeah, I mean, if you respond to somebody that 2.5 hours later, even if it's on a Saturday or Sunday, like, cool. If they decide to go somewhere else, well, that's why you have, a Google presence where they're like, I'm going to wait till I hear back from these guys before I go talk to somebody else.
Sure. So being present is big for us, and it's a learning curve. We're still learning that.
It is. I'm learning.
So never be too hard on yourselves either.
Yes.
You can't be too hard on yourselves. We have little kids. Mine's 7 and 1.5.
Oh.
And I saw your girls
We
are
have
young.
3 and 5 year old.
So they're young. It's a nice age. They can be friends and get along.
They're friends. They get along. They don't
fight.
get along.
They get along until they get along until they don't, right?
I know. Yeah, they're gonna grow up together and be strong together.
Yes.
That's the best.
But the whole reason why I started it, I'm so much more flexible than when I was working for someone else.
Sure.
Right.
And next week is our anniversary. Clinics closed Monday and Tuesday. Nice. We're going to the beach.
Cool. Enjoy
I
it.
couldn't, I'm not saying I couldn't do that before, but I had to see if I had PTO. I had to see, all that other stuff. I just told my patients, I'm not available these days.
Sure.
All of my patients, honey, go ahead, have some fun. I never have issues with telling them the clinic's closed.
That's nice.
Yeah.
That's really nice. You have a good patient database.
Yes.
Yeah, they should want that for you as well. Give yourself a break. You've been caring for us for 362 days out of the year. Enjoy the 3 away.
Yeah.
And the ones that aren't like for it, then that's like an easy filter process to get out.
Yeah. Right.
I don't want that. You know what I mean?
Most of them don't complain because they don't want to come anyway.
They're like,
true.
Well, they actually come for Andre because he's a good talker.
Sure.
Like, they know I'm going to get them to work. I love them, but they're like, where's Dre?
I know.
They play around. Like,
look, I have a succession plan, all right? Like, so we seeing all these, a lot of Medicare people, a lot of, so, I always said, look, hey, I'm going on all these treatments, and there's, 65, 67-year-old women, and they always want to see me. I'm I have my succession plan. If you ever feel like kicking me out, I got a place to land.
I know, he's got backups.
Yeah, there we go. I'm good.
I love it. Oh, man. No, it's fun. Like, we're, all we do is PI in our world. You're doing a lot of more, like, help, maybe dabbling into the PI world. One day we'll cross paths, work together. And because a lot of our clients, they need post-surgical care or maybe an option that's not surgery.
Right.
And those are some great things you can offer them. they can find you, Roswell, Georgia.
Yes, so you can find us on bodygoalspc.com is our website. We're on Instagram, body_goals_ATL. And the same for our Facebook is Body Goals ATL all together. So we're here in Roswell. We also see people in the metro Atlanta area, depending on your zip code. The brick and mortar is there, but if you're scared to come out, you could call the office and see about the home visits if you apply for that. And we also have virtual and we do telehealth right now too. I take most insurances, and I'm out of network for some. And we also do like wellness, cupping, dry needling, which is also using the acupuncture needles. We do everything.
You're
massage.
Doing all that. That's all you.
Yeah.
Good.
So I do massage and all that. So you do not have to be injured to come to me.
Absolutely.
You can come for massage and wellness. I have all that background too. So that's how I try to open up, try to be different. So I'm like a boutique type physical therapy clinic, not just like a cold clinic. When people come, they take their shoes off. It's really cozy inside. And usually my motto is one-on-one treatments. Sometimes I see family or husband and wife that they're in there at the same time. But most of the time, even before COVID, I was always one-on-one when you're in the clinic.
Sure. Even like you said, wellness and care. I went to Target yesterday to get my son some Legos. And on the way back, I saw a stretch zone. And I've always been inquiring about that. And I walk in there, it's open till 3, it's 2:30, and no one's there. It's wide open.
Yeah.
I walk behind the wall, like no one's there. There's laptops out and everything. I'm like, what are you guys doing? No one's even in there. So I stood there for 5 minutes and I just left because nobody ended up coming there. But I want to maybe start doing that maybe once a week. Do you do any kind of stretch therapy?
Yes, absolutely.
Okay, of course,
because I deal with a lot of athletes.
Of course.
Deal with a lot of Falcons players, professional athletes to this day. A lot of high schools, we do a recovery program.
Sure.
So I'll do the stretch therapy. We'll do the cupping. We'll do the soft tissue massage, put you in the compression boots.
Okay.
Everything, all that's included in one package. So I'm not just doing the stretching. And then I'll give you corrective things for what I see.
Cool.
And then, so
Good to
I definitely
know.
do the stretch therapy, but I don't call it stretch therapy.
Absolutely. That's good to know.
But I know about stretch zone. So
cool.
yes.
Yeah, I didn't even think of that. And I'm happy I asked you because stretch zone's
come
off my.
in.
Absolutely.
Yeah, come in the Body Goals for that.
Very cool. Now I know.
Yes.
Anything you want to throw in there, Zach?
No, I think I was just thinking basically because you're talking about Metro Atlanta. I mean, anybody will drive for somebody good. You know, we're with a lot of providers. I don't care if it's an extra 10, 15 minutes. You know, you come up to Roswell, as long as you're getting cared for. I mean, it's your body, right? At the end of the day, it's the most important thing you have is your health and your body. And sounds like, you know, you guys just have kind of an awesome tandem of working on the mental. Everything is goal setting at the end of the day, right? Whether you put it on paper, even if you're not thinking about it, you know, we're all, you know, kind of goal driven. You wake up with a, you know, intention to do something and hope for, I guess, you know, whatever you're, you know, shooting for. So I really like, you know, that model of goal setting. It's huge and it keeps people accountable to, you know, not, they can't throw it back in your face because, you know, you're like, dude, I've been telling you doing your stretches every morning, and you did them twice this week.
Yeah,
you know, and people are lazy. I've heard that story so many times doing personal trainings. We did a little corrective exercise as well for the older population, and it works. You just got to do it. You know, you gotta get hooked up with Dr. Q and Andre and follow your treatment plan, man.
For sure,
it's the biggest thing you can do.
Anything you guys want to throw in there before we wrap it up? Anything on your mind?
You know, I was thinking about
Another
this.
story. I like the first story. That was good. Yeah.
No, I was thinking about this though. Obviously, because I'm a speaker and I talk to kids all over the country and all that. But when you talked about, we're talking about business and talking about just like how much time it takes.
Sure.
Right. And so for anybody out there who is in that business part, right? Because this is obviously a business podcast, and so who was in that business, you know, just make sure. I always think about make sure you think about why you want to make so much. Right? Like, so a lot of times we work so hard and we do so much stuff and then we just don't have the time to be able to enjoy what we're working hard for. And then it's 20 years later and you don't even get to enjoy the fruits of your labor. And so a lot of times, it's like you were saying, you know, it's just stopping and being present and just saying like, hold on, why am I working this hard if I can't even enjoy what I'm working for? Right? Like, you know, and so, and this is what I try to tell her and, you know, a lot of times and everybody else is like, don't build yourself a job. Right? Like build yourself a business, build yourself a brand. So when you own the business, you can take off and it's fine. But don't build yourself a job where you feel like, man, I have to put that out. You have to be there. Like that, you know, that's the messed up part about it sometimes. So I think that people can get kind of lost in that, thinking that they're, you know, again, they're hustling, grinding and stuff like that, which is good. But at the same time, man, you just have to know, like, why am I doing this? And let me just stop and just enjoy the day sometimes. Just like what we're going to do.
No, that's a
this
great
week.
example.
Yeah.
You have to go. You have to have that me time and your time. Like, and I posted it, like, what is your why, right? You know, and I always wonder, like, what is the why? I love working hard because I love taking care of my team. I really enjoy my team. I like seeing them rise up and level up as we get better, right? I also like working hard is because we came from nothing. Like, you know, my parents were on welfare. Actually, my mom was a single mother moving to this country from Russia. I'm from Russia.
Oh, wow.
I can speak fluent. So we came here when we were 3, but we were on welfare. We had nothing, right? So I never want to have nothing again. And, you know, I worked so hard for my kids to make sure that they never have nothing, but they're also, they have to be hungry. Because I can't work all myself, and then now they're going to be lazy little schmucks, you know? They got to work. So you have to find that balance of when you got to tell them no. But I work hard. I love taking care of my team, and I really love to make sure that no one's ever going to tell me no. I don't like, you know, I don't want, no one's going to tell me no. I'm going to, whatever I want to get, if it makes sense, I'm going to get it.
I'm going to get it.
That's why I work, right? And I can help people around me that are my core rise up with me. My kids never have to worry, and I want to just crush it. I'm not even thinking about them. I'm thinking about like their grandkids.
Yep.
That's why I'm working this hard. That's my mindset.
And, you know, last thing I do want to say this
Please.
is just, you know, in terms of football, there's a term in terms of where, you know, if you punt the ball too far, right, and you outkick your coverage. So I actually feel like, you know, in terms of me marrying a doctor, like I've absolutely outkicked my coverage. I've outkicked my coverage with her, man. I really have. And then the last thing is just thank you all for just
Thank you so much.
for hosting us on this.
No,
This is amazing. We love what you were doing. We
Appreciate
love
that.
just building relationships. So just thank you for doing.
I appreciate you guys coming on, and you cold called me to start this from the beginning.
Right,
Remember?
there you go.
So
Yeah.
you did it, right? And it transforms into a relationship. Who knows what it could blossom into?
That's right.
And that's what it's about. Like, that's what it's about. You know, I appreciate you guys coming on. Thank you for your
Thank you
time.
for having
and hope you
us.
guys have an amazing week. Great way to start.
Definitely.
Thank you.
Yeah,
This is awesome to start a Monday.
Likewise. Thank you guys so much. We'll be obviously in touch. I look forward to just a continued relationship. It doesn't always have to be about the dollar. You know, you meet good people, solid people that, you know, just care about their community and other people. And those are the people that Melman Law Group and David and myself want to be around. And that's what it's all about. Just love, you know?
That's
Yes,
it.
absolutely.
Cool. Thank you guys.
Thank you.